Hello, we have made it to the final week in the semester. Hard to believe that we are here, but it is week 15. It is the last week of clinics. That means that this is my last video as well. I do hope that you have found these helpful this semester as we've been looking for ways to increase communication and try to help keep everybody on the same page. All right, here's our information for this week. All skill evaluations are due this week, whether they are first year or second year. Most students did a nice job working ahead. So I don't think there's too many that are going to be happening this week. However, this is the final week that they can be done. Any skill evals that are not completed will result in a fail grade for that student for clinic. So hopefully we can get those all taken care of and completed this week. We do have open clinics this week. For first year student, Thursday, May 1st, the afternoon clinic is an open clinic. And for second year students, Wednesday, April 30th, both the morning and the afternoon session are both open. What that means is that any student can sign into those clinics. They're not assigned to any of the particular clinic groups. They are looking pretty full for both first and second year students. So lots of patients on the schedule. So I don't anticipate any changes. Sometimes they're a little bit quieter, but I'm not really seeing that this year. So they should function pretty similarly to how they normally do. Students are allowed to leave the session once they are completed. They don't have to stay for the entire session. So if their patient's done and their unit is cleaned up, disinfected, they are allowed to leave for the day. That does mean that they would have permission to run their evacuation solution and take their trash out earlier than they normally would. But of course, we'll ask them to do that quietly and respectfully so that it's not disruptive to the patients in the clinic. If a student, though, is using the open clinic as a makeup clinic because they missed hours and they need to make those up, they may not leave early. They need to stay till the end of the session, and they do need to stay engaged in clinic activities until the very end. All right. Reminder, Thursday, May 1st are the informative posters for first year students. So those are at 7 o'clock in the atrium. And if you are able to attend, please do so. First years love to see familiar faces at the poster session. For clinic faculty, if your clinic is quiet and you feel like you can pop over for a minute, you are welcome to do so. And for the second year students in Thursday night's clinic, if they finish their patient early and they would like to come over and see the posters, that is fine for them to do so as well. The graduation party, which is hosted by the NEODHA, is this Wednesday at Pastina at 6 o'clock. If you're able to attend and you haven't let Nicole know, please let her know this week. Let's see. Next week, of course, we don't have clinicals, but just to let you know what's going on, first year students are taking final exams. Those go through Thursday of next week. Second year students take their mannequin exam, the CDCA exam, on May 7th. We do expect that they will get results that very day, within a couple hours of completing their exam, because they are graded on site. If you're here next week for any reason, we cannot have anybody in the clinic area or the classroom after 12 p.m. on Tuesday. That's when the examiners are here to set up, or at any time on Wednesday. So if you are popping up for any reason, please do not enter the clinical area or the classroom during those hours. Second year students will be walking at commencement on Saturday of that week. Their ceremony is at 10 a.m. I will, at the end of the semester, be sending you your faculty evaluations. I'm not quite sure how quickly I'll get to those. You'll either get them in May, but I may extend it out to June. So I'm not quite sure yet, but I will get your faculty evals to you. Those are the evaluations completed by the students. If you would like to have a meeting with me to review your evaluations over the summer, just send me an email and I'll be happy to get together with you to review those. For the fall clinic schedule, Jill and I will, or I should say Jill and possibly the new program director, will be working on that schedule as soon as they are able. We are still waiting for the new program director to be announced by Human Resources, so I don't have an update for you at this time. It will be at the discretion of that director and Jill to get people placed in those fall clinics, and they will do that as soon as they are able. I don't have a solid timeline for you. I can just hope for you that that happens by mid-May. That's my best guess. So we'll cross our fingers and hope that that works out okay. If you have any questions, though, of course, reach out to me at any time. That's all I have for you. I do want to thank you all for a really wonderful spring semester. I appreciate everybody pulling together and really working hard to get through the semester. Thank you for all that you do, all the support and encouragement and instruction that you provide to our students. We could not do this without you, without our strong clinical program. So I thank you. I'm sure I'll see each and every one of you on campus this week, but just in case I miss you, I hope you have a wonderful summer and I look forward to seeing you soon. Bye-bye.